Hi everyone. This is going to be my pregnancy vlog. I am very excited to start this vlog because for a long time I've been watching all kinds of YouTube vlogs, from It's Judy's Life to Superwoman. So huge fan of vlogging, and I thought my pregnancy vlog is the right thing for me because I've had so many questions and so many doubts about my pregnancy that I've turned to Google and I've turned to YouTube. All these sources have been great for me, so in answering my questions and my doubts. So if there are any other moms out there who are having, similar questions, doubts, I just hope that this vlog helps you. So in my vlog, I'll talk about, my symptoms, my, complications that I've faced and luckily overcame. I want to talk about just my day-to-day experiences and how I feel. And yeah, so I hope that this, other moms can relate to this and that it helps answer some of your questions maybe. So feel free to reach out to me. Yeah, so this first vlog, I really want to talk about my first trimester. I'm currently 17 weeks pregnant, 17 weeks and three days, but I'd like to talk about my first trimester because this is when a lot of my complications started, and it was basically a roller coaster ride, literally. So I found out I was pregnant in December, and 2 days later I started spotting, and it started off as a brown discharge or brown spotting, and soon after turned to like a pinkish discharge, and it really scared me. So I called my GP. I called Telehealth Ontario because I live in Ontario, and I was told to monitor the situation, and if things got worse to the point where I was bleeding, that I'd have to go to the ER. So one night I was feeling really fatigued, unusually tired, and the next morning when I woke up, at this point I was wearing a liner because I was spotting to that extent, and in the morning when I woke up, my liner was just drenched in blood. So it looked like I had had my period, and when I went to the washroom first thing in the morning, I also had blood in the urine, and there was also some blood clots. So this was very scary. I thought the worst, and I went to the ER right away. The ER doctor told me that perhaps this was an ectopic pregnancy because another symptom I had was pain in my left abdomen, lower abdomen, and it was like this really weird, like pinching, sharp pain, and it was in just one particular area. So he told me that, yeah, it could be an ectopic pregnancy, which means that the baby or the embryo is lodged in the fallopian tube or somewhere other than the uterus. So this really scared me, and I was just at the ER waiting to get an ultrasound done. And once the ultrasound was done, so I waited like a total of 8 hours. It was just very brutal. The technician wrote that maybe I had lost the baby because there was some fluid. They saw a mass in the uterus, but they weren't sure if it was an embryo or not because I was so early in the pregnancy. At this point, I was about 2 to 3 weeks. And also, he wrote that this may not be a viable pregnancy if I hadn't miscarried already. That what that means is eventually I will. So I was to follow up with an early pregnancy clinic, and I went and saw them every 48 hours for them to monitor my HCG level. And what they saw was that what you're supposed to see that early in your pregnancy, about 2 to 3 weeks, is that your HCG level is supposed to double every 48 hours or so, but mine was not doing that. So at the ER, I measured about 5,000, and 2 days later at the early pregnancy clinic, I was at about 7,000 to 8,000, within that range. And then I measured again, and again, I was within the range of about 9,000 to 10,000. So it wasn't exactly doubling, and this really scared me, and every day that I'd go to the clinic, I'd see a different doctor, whichever OB was on call that day at the hospital. So they were telling me things that I really didn't want to hear, that this was most likely not viable, and that I would lose this baby, or that I'd have to get a shot to get rid of it, that it could be ectopic, that it wasn't ectopic. It was just crazy. So there was a nurse at the clinic that I'd see every day that I went in. And she kept telling me, because I would just break down every time they tell me something like this. And she told me, 10 to 15% of women, their HCG levels don't rise normally. So it doesn't double necessarily. And she said, maybe you're in that range of 10 to 15% women. So, don't lose hope. And I held on to, that. I held on to hope. I held on to my faith. And I was still spotting at this point. So, and I still had that pain in my abdomen. But I didn't have that severe bleed that I had that morning that I went to the ER again. So I was really confused, and I was so anxious not knowing what exactly was going on. Am I pregnant? Am I not? Like, what's going on here? So I called my GP and I told him, please give me a referral to an OB. Because I just can't. I just need someone to talk to, and someone I can see consistently. I don't want to see a different doctor every day and explain my symptoms all over again. And so he gave me a referral, an urgent referral to an OB. Usually OBs in Toronto, where I'm from, don't see you until you hit the 3-month mark. So they want you to have passed the first trimester. But my referral went through as an urgent referral because of the complications, and she did see me, thank God. And I explained everything to her, and at this point I was about 6 weeks once I was seeing her, and she had me do an ultrasound. And the technician who did my ultrasound didn't say anything to me, but I was waiting to hear from the doctor. I was actually at the hospital, and she walked into the room and she told me, your baby is okay, and that the baby had a heartbeat, and there was an amniotic sac, there was a yolk sac, so everything looked normal. And I was so relieved to hear this, because I went in prepared to hear the worst, and she told me the best news. So I knew at this point that I had not lost the baby, and I was very, very happy. But I also had doubts in my mind, like, why did I bleed? Like, what exactly happened? So I went back to my GP, and my GP was telling me in the beginning of my pregnancy, when I found out, as soon as I found out that I was pregnant, he said, your thyroid levels are normal for a normal woman your age, but because you're pregnant now, your thyroid levels are actually low, considered to be hypothyroidism. And before he could even treat me, I was having all these complications, so he didn't put me on any medication. But soon after I found out that the baby was okay, he started me on Synthroid, which is at a dose of 0.05 milligrams. And he connected me with a specialist who deals with thyroid complications during pregnancy. And this doctor, at my first appointment, when I told him all the complications that I had, said hypothyroidism, so low levels of thyroid in the body, can be extremely dangerous for a baby, and that it's a very common cause of miscarriage in women. So he said, you're bleeding, and all the symptoms you're telling me could very possibly been because of your hypothyroidism. And he said that he would treat me aggressively with dosing, with the level of dose for Synthroid. He said, because even if you get to a level where your thyroid level is high, so even if you're hyperthyroid, that's fine. That's even possibly good for the baby. But low levels of thyroidism, or having low levels of the hormone, are extremely, extremely dangerous, especially for brain development and things of that nature. So I continued on the dose of 0.05, and 2 weeks later I did blood work, and the specialist told me that I had to increase my dose to 0.075 milligrams, and I continued that for 4 weeks. And then soon after, I was put on an even greater dose of 0.1 milligrams. So currently, 17 weeks pregnant, I'm taking 0.1 milligram of Synthroid. But soon after starting about 0.075, I noticed that my spotting stopped, and all of my the spotting, the discharge, the pain that I had in my abdomen, all of that disappeared. So I definitely do think that the symptoms that I had were because of my hypothyroidism, and it's a very dangerous thing. Most women, if you're trying to get pregnant, if you're trying to conceive, have their blood work done, you know, start folic acid, start taking some kind of prenatal vitamin. But I hadn't done any of those things. And I just want to say to those women who are trying to conceive, just make sure that you get your blood work done so you know, if everything is in good order. And make sure one of those things, or one of the tests that you do definitely get done, is your thyroid level. So check to see if your thyroid level is okay, because as I mentioned, hypothyroidism, having low levels of the thyroid hormone, could be detrimental, but having high levels seems to be okay. So that was my first trimester. It was an up and down roller coaster. I'm currently 17 weeks pregnant, and everything seems to be going okay so far. And soon after this video, I will share with you my 17-week pregnancy vlog with my symptoms, with my baby bump. So I'll see you soon. Hope this video helped. Bye.